Welcome, everyone. This is Lecture 3. We're at the home stretch. The success of the game Bookworm Deluxe was followed by its successor, Bookworm Adventures. So, are you having a great adventure so far? Do you feel a level up in your knowledge? Has it reinforced your reading assignment knowledge? I certainly hope so. In this section, we will now discuss blood, intestinal and liver flukes, and tapeworms. First, some generalizations. In flukes, there is an alternation of generations. There is usually more than one host involved to complete the life cycle as illustrated here. The blood fluke of interest for us Filipinos is the Schistosoma japonicum, which is highly endemic in regions 8, 10, 11, and 12. We can tell the species apart by virtue of their ultimate destination. In Schistosoma japonicum, it's the superior mesenteric veins, whereas in Mansoni, the inferior mesenteric veins, and in Hematobium, the perivesical and periureteral venous plexi. Adult blood flukes are specifically designed for reproduction. Remember that the male and female are usually inseparable, as the male has an anatomic adaptation for getting into the groove. These factors are closely intertwined, as well as human lifestyle that promotes their spread. Swimmer's itch is the first symptom of schistosomiasis. Later, snail fever or Katayama fever is a febrile illness with chills representing an immune complex disease associated with early oviposition and infection. About 4 to 6 weeks after the initial infection, the Katayama syndrome will occur, consisting of the generalized lymphadenopathy with enlargement of the liver and the spleen, which is typically observed in patients with active infections as a protuberant or big belly. Chronic schistosomiasis happens when the hooked eggs are laid on or travel to body organs and is retained in host tissues. This associated chronic granulomatous injury can occur in the urinary bladder, ureters, intestine, liver, and less often the lungs and central nervous system. For the diagnosis, identify the eggs in appropriate specimen, either in stool or urine, and use other accessory diagnostic techniques. Treatment is via praziquantel. Ensure that intermediate hosts are exterminated and avoidance of swimming in known contaminated bodies of water is mandated. Again, in summary, schistosoma infections are treated with praziquantel and prevented by avoidance of swimming in contaminated waters, extermination of mollusks, and proper waste disposal. If you have decided to live a clean lifestyle, avoided mosquito bites, and even became a vegetarian, remember that ingestion of wild watercress, lettuce, and alfalfa can still be dangerous if they are watered by or are in residence in bodies of water that serve as homes for metacercaria of the Fasciola hepatica, or the sheep liver fluke. Upon ingestion, they exist and penetrate the intestinal wall, liver capsule, and liver parenchyma. They will later enter the bile ducts, hence leading to a spectrum of symptoms described by the following: jaundice, cirrhosis, cholestasis cholangitis or cholelithiasis, elevated liver enzymes, and esophageal varices. This is the gross appearance of the adult parasite and the microscopic picture of the egg. Fascioliasis is treated with the antiparasitic triclabendazole or bithionol, which does stand out as unique from the rest. So far, and in the incoming slides, you will see that for most flukes, the treatment is praziquantel. The East Asian variant of liver or bile flukes is worth mentioning because in heavily infected individuals and over time, it can actually lead to a cholangiocarcinoma. Imagine a parasite that can cause a cancer. Acquisition is by the ingestion of undercooked or salted or pickled or smoked freshwater fish, in short, uncooked, that harbor metacercaria. Characteristic eggs may be recovered in feces or duodenal aspirate specimens, and treatment is via praziquantel. Certain flukes have a predilection for the lungs. This is exemplified by the Paragonimus westermani, which is common in the following provinces in the Philippines. The adult flukes are quite large, but they're pretty cute, I think. Ingestion of raw freshwater crayfish or crabs, typically burong talangka in local delicacy. Those with metacercaria exist again in the duodenum, travel through the intestinal vessels, and into the lungs where adults lay eggs. It is spread by spitting or alternately swallowed and then later passed into the stool. In a minority of cases, there are also extrapulmonary symptoms as well. Classic pulmonary TB-like symptoms are seen in paragonimiasis. 98% of symptomatic children have hemoptysis, and co-infection with tuberculosis is common. Chest X-ray in paragonimiasis patients reveal patchy infiltrates with nodular cystic shadows or calcifications. Rings a bell? It does resemble tuberculosis. We can locate the eggs in the sputum, lung fluids, and stool. The drug of choice for lung fluke infections is praziquantel. Prohibition of spitting should be universal for both hygiene and paragonimiasis prevention. Avoid eating raw crabs and crustaceans. The family of intestinal flukes, on the other hand, include all of the following. While mainly a disease in cattle, these may infect humans as well, and symptoms are digestive in nature. A high index of suspicion by history of exposure and identification of the characteristic eggs is diagnostic. Treatment is with praziquantel. Level 9 tells us that flukes in general are treated with praziquantel. Prevention is by controlling the intermediate host, proper waste management, and proper food preparation. Moving on to the next super level, the chapter on tapeworms. Tapeworms are remarkable creatures because they can grow very, very, very long, hence their name. Did you know that these proglottids are motile, so they can be observed moving in stools and even in underwear? Physically, taenia can be differentiated by proglottid appearance by microscopy, and there is actually a new generation of taenia that look like beef tapeworm but are clinically as invasive as the pork tapeworm, which can actually be differentiated only by serology. Evolutionary adaptations are on the move. Remember this. Taenia solium or the pork tapeworm is definitely more dangerous than the beef tapeworm. Both can cause digestive symptoms when infected meat is ingested. This will manifest as mild GI symptoms or nausea and diarrhea, abdominal pain, and anal pruritus. Whereas, if the eggs of the pork tapeworm are the ones that are eaten with contaminated food or water, be afraid. Be very afraid. These are neurotropic, causing neurocysticercosis. Seizures are the representing finding in more than 70% of cases and can include any of the following neurologic manifestations. I would like to emphasize that neurocysticercosis can only be caused by the pork tapeworm infection or Taenia solium. While Taenia can be identified by examining the stool for proglottids and scoliosis, in serious neurocysticercosis, neurologic imaging techniques can be used. These are the list of other diagnostic modalities to confirm Taenia infection. Treatment is different based on the type of infection, including antihelminthics, supportive measures, and surgery. Sometimes it is hard to treat, especially in advanced cases. But take note, prevention is no different than the usual standards of hygiene, waste disposal, and meat handling or preparation. Let us not forget this tapeworm member, the longest tapeworm species that can reach up to 10 meters, the Diphyllobothrium latum, which also causes significant B12 or folate deficiency. Clinical manifestations include megaloblastic anemia, glossitis, and signs of spinal cord posterior column degeneration. These are manifested by loss of vibratory sense, proprioception, and coordination. As a recall, TAENIASIS induced by adult tapeworm infection can be treated with praziquantel and prevented with proper carcass disposal, wash, prevention of ingestion of raw meat, whereas Taenia solium cysticercosis, which is acquired by ingestion of the eggs in contaminated food or water, can be treated mainly supportively. The complications are diverse. There can be a trial of albendazole. Control measures, treatment of carriers, excellent hygiene, and most especially avoidance of the ingestion of contaminated fruits and vegetables which may harbor the eggs. There is probably a low chance of ever finding this next tapeworm in the Philippines, but it is hyperendemic in China and Africa. Humans become infected by ingesting eggs, and the oncospheres encyst in various organs. In children, the most common site is the lung, while in adults, it's in the right lobe of the liver. Larval stages wreak havoc in the human host either as the cystic type or alveolar type. We are careful with the physical removal of this because rupture will spill the protoscolysis and produce new daughter cysts. After being asymptomatic for years, the clinical manifestations are myriad. Patients may suffer from vomiting, abdominal distension, and compression symptoms due to the liver enlargement. Chest pain, cough, and hemoptysis may occur when it involves the lungs. Pathologic fractures when the bones are involved. Infertility and hematuria when it is in the GUT. These are examples of post-mortem specimens of patients with alveolar type of echinococcosis. Imaging techniques are quite important. In fact, when using the ultrasound, this will also reveal hydatid sand in the liver cysts, which are motile. Using radiography, CT scan, or MRI will help reveal the location of the lesions. Treatment is therefore special. The procedure is called PAIR or PAIR in combination with albendazole that is highly effective. Surgical extraction, when done, must be handled with extreme care. Therefore, care of dogs by deworming, proper feces disposal, and safe water sourcing are preventive. Echinococcosis that is treated with PAIR can be prevented by proper hygiene, meat inspection, and proper dog care. So many worms, so little time. I hope that you had a productive but cerebral afternoon with me, your lecturer, Dr. Melissa Ompico. I would like to thank you for spending these last few hours of your afternoon with me. I hope that you will be able to learn lots more when you do your further readings and be challenged with the assignment of formulating your own quiz show questions. Time for some more Paligsahang Parasitiko sample questions. Question number 1. Wuchereria bancrofti is transmitted by? And the answer is Aedes species. Question number 2. Which is the best time to extract blood to isolate maximum microfilarial levels of, take note, the blood filarial worms Brugia and or Wuchereria filariasis? The answer is 10 p.m. to 2 to 4 a.m. How about in loiasis? It's diurnal in the mornings. Question number 3. An adolescent patient presents with stupor after new onset seizure. CNS imaging shows a distinct contrast-enhancing frontoparietal lesion. Careful CSF examination shows eosinophilic pleocytosis. History from the patients reveal a past history of expectoration of rust-colored sputum and recent dietary history of ingesting soy sauce marinated raw crab while on vacation to the Visayas. The cause is likely? I know you know the answer. Paragonimus westermani.